What did German combat medics actually study during the Second World War? Were they minimally trained stretcher bearers? Were they battlefield surgeons? Or were they something more structured and more limited than either myth suggests? Today we'll be examining the institutional medical training system of the Wehrmacht, focusing on enlisted medics, medical NCOs, the formal curriculum, named training centers, field manuals, and comparison with allied systems. This is institutional history based on documentation. The Wehrmacht medical branch, the Sanitätsdienst des Heeres, was not improvised. It was a parallel administrative system embedded within the Army, the Heer, the Navy, the Kriegsmarine, and the Luftwaffe, or the Air Force. Within the Army, personnel fell into distinct tiers: Krankenträger, or stretcher bearers, Sanitätssoldaten, enlisted medics, Sanitätsunteroffizieren, medical NCOs, Truppenärzte, unit physicians, or commissioned officers, divisional surgeons, and Feldlazaret surgical teams. Oversight of the entire system fell under Siegfried Hahnlose, chief of the Wehrmacht Medical Service. Hahnlose's office coordinated curriculum development, medical regulations, or Heeresdienstvorschriften, supply standards, and evacuation doctrine. Before we move further up the medical hierarchy, we need to clarify something often misunderstood. Not every man carrying a stretcher in the German army was a trained medic. Many were Krankenträger, literally sick bearers or stretcher bearers. Within the Wehrmacht, or the Sanitätsdienst des Heeres, the Krankenträger occupied the lowest tier of the medical evacuation chain. They were not Sanitätssoldaten, they were not medical NCOs, and they were not physicians. They were merely evacuation personnel with the most basic form of medical training. According to German Army Service Regulations, or Heeresdienstvorschriften, the primary task of the Krankenträger was the recovery and transport of wounded personnel from the line of fire to the regimental aid post, or troop bandaging station, whichever was easy to get to during that period of combat. Their job was physical extraction, often under heavy artillery fire, small arms fire, or armored engagement. They were typically assigned at company level. Unlike Sanitätssoldaten, Krankenträger did not undergo extended medical schooling. Their preparation usually consisted of basic infantry training, short medical familiarization course, instruction, instructor drill, basic bandage application, and casualty lifting and transport methods. In many cases, the training lasted only a few weeks. They were often drawn directly from infantry ranks and designated for medical evacuation duty within the company. Krankenträger instruction focused on safe casualty lifting techniques, 2-man and 4-man stretcher carry, improvised stretcher construction, movement under fire, basic pressure bandage placement, and recognition of severe bleeding. They were not trained to administer morphine independently, conduct formal triage, make medical decisions, or perform invasive procedures. If bleeding control was required, it was typically limited to a simple pressure bandaging until a Sanitätssoldat could take over. Essentially, think of them as the War of the German equivalent of someone who holds a BLS. Despite limited medical authority, the Krankenträger performed one of the most dangerous roles in the medical chain. Casualty extraction required entering exposed terrain, moving through artillery impact zones, navigating minefields, and carrying wounded soldiers sometimes over long distances. On the Eastern Front, evacuation distances could extend hundreds of meters under combat conditions. Without the Krankenträger, even the best trained medics could not function effectively. When modern audiences see photographs of German soldiers carrying stretchers, they often assume that they are medics. In many cases, they were not. They were Krankenträger, trained primarily in evacuation, not treatment. Understanding that distinction prevents two common errors: overestimating their medical training and collapsing all medical personnel into a single category. The Wehrmacht medical system was tiered, and each tier had defined limits. The Krankenträger retrieved wounded. The Sanitätssoldat stabilized and guided the Krankenträger in combat. The Sanitätsunteroffizier supervised triage and guided the Sanitätssoldaten and the Krankenträger teams underneath them. The Truppenarzt provided advanced medical intervention, and surgeons did major operations at the field hospital. Each role was structurally distinct. The Sanitätssoldat was the baseline trained combat medic. They were selected from infantry recruits, often based on literacy, aptitude, and civilian medical exposure, such as an orderly, a nursing trainee, or as a medical student. Depending on what stage of the war, their training duration varied. From the early war, from 1939 to 1941, it was 4 to 6 months of specialized instruction after basic training. For the mid-war, from 1942 to 1943, it was 3 months. And from the late war of 1944 to 1945, it was often only 6 to 10 weeks due to manpower shortages. Instruction occurred at the Heeres Sanitätsschule in Berlin, the Militärärztliche Academy Berlin for officer track medical training, and the regional Sanitätsersatzabteilungen, medical replacement battalions. Examples of the latter are Sanitätsersatzabteilung 3, Hamburg, or Medical Replacement Battalion 3, Hamburg, or Sanitätsersatzabteilung 9, Kassel, or Medical Replacement Battalion 9, Kassel. The primary doctrinal text for the training and instruction of enlisted medics was the Handbuch für den Sanitätsdienst im Felde. Core instruction in this book included hemorrhage control, pressure bandaging, tourniquet application, morphine dosage protocols, shock recognition, fracture splinting, wound dressing, evacuation under fire, hygiene, and disease prevention. Cold weather medicine became particularly important after 1941 during operations in the Soviet Union. An enlisted medic could administer morphine under regulation, could apply tourniquets and splints, could categorize basic triage, could not perform surgery, and could not independently alter evacuation protocol. They were stabilizers, not medical decision makers beyond immediate care. Sanitätsunteroffizieren, or medical NCO training. This is where nuance becomes important. A Sanitätsunteroffizier was not simply a senior medic. He occupied a supervisory and administrative medical role. They were typically promoted from enlisted medics, often had a longer service record, demonstrated competence, sometimes partial medical university education, and occasionally prior civilian nursing experience. Medical NCOs often attended instruction blocks covering advanced wounded assessment, extended triage categorization, documentation standards, medical supply accountability, and regimental aid post management. Training still occurred within the Heer Sanitätsschule Berlin, regional medical battalions, and divisional-level refresher courses. Medical NCOs had expanded authority compared to their Kameraden in the Sanitätssoldaten, or as enlisted medics. Medical NCOs could supervise enlisted medics, run a regimental aid post in absence of a physician, prioritize evacuation categories, maintain casualty records, and coordinate with a Truppenarzt, or troop doctor, and perform minor surgery. They still could not perform major surgery, conduct amputations except in catastrophic emergencies, or override commissioned physicians. There is a functional distinction. The enlisted medic does immediate battlefield stabilization, the medical NCO does supervisory triage and medical administration at aid post level. The difference was depth of responsibility and amount of trusted authority. Medical training for commissioned medical officers. Above the medical NCO were commissioned physicians, Truppenarzt. They were fully credited physicians, university trained and commissioned as an officer. Their training pipeline included civilian medical degree, military officer training, and service to the Military Ärztliche Academy Berlin. These officers performed surgical procedures at main dressing stations, advanced diagnosis, evacuation decisions, amputations, and thoracic and abdominal surgery. This tiered structure prevented enlisted personnel from exceeding their training. The medical evacuation chain worked as follows. The Sanitätssoldat stabilizes. The Sanitätsunteroffizier supervises triage and directs Sanitätssoldaten. The Truppenarzt performs advanced treatment at the main bandaging station, and the surgical team, major operations at the field hospital or Feldlazaret. This structure closely mirrored World War I doctrine. One thing that's also important to note is a comparison of this system to the Allied medical systems during the Second World War. U.S. Army trained combat medics at facilities such as Camp Barclay. Training included 10 to 16 weeks, plasma use, shock treatment, bandaging, and evacuation training procedures. Senior medics functioned similarly to German medical NCOs. Under the Royal Army Medical Corps, British medics trained in regimental aid post operation, advanced dressing stations, and casualty clearing stations. Structurally, the hierarchy was medic to NCO supervisor to physician to surgeon, remained constant across all armies. One thing that's also important to note is the distinction of the German Army Medical Corps, or the Sanitätsdienst des Heeres, from the SS equivalent of the SS Medical Service. The Waffen-SS remained a separate medical bureaucracy. Its training institutions were distinct. While the Army medical system followed standardized professional military doctrine, the SS medical system was ideologically integrated with the party structures. They were institutionally separate, administratively separate, and under different chains of command. By late war period, from 1944 to 1945, we see the degradation of the German Army Medical Corps. Training compressed dramatically. Experienced NCOs were killed or captured. Rapid battlefield promotions took place, which reduced overall practical competence. The doctrinal structure remained, but execution degraded under pressure. So what did German medics actually study? Enlisted Sanitätssoldaten studied emergency stabilization. Sanitätsunteroffiziere studied supervisory triage and medical administration. Truppenarzt studied full surgical authority. None of them were interchangeable. Understanding these distinctions prevents myth-making in either direction. It neither glorifies nor simplifies, it documents. Thank you all so much for watching this video. I really appreciate you all supporting me and my channel. Hope you all have a great rest of your day. Please like and subscribe. God bless y'all. White Helmet History, out.